Good morning everyone, I am Dr. Sandeep Tandel, General and Laparoscopic Surgeon. As we are continuing our topics videos on the swellings all over the body, today's topic I have selected is another common swelling which occurs frequently from children to adults to the elderly people, that is a lymph nodes, lymphadenopathy or lymphadenitis. So we will discuss what is the lymph node first, what is lymphadenopathy, lymphadenitis in this video today. So first of all, I will tell you what is lymph, why it is called as a lymph. Lymph is a Latin word for the water. That is the water which is flowing through the channels. So we have a lymphatic system. So what is lymphatic system? Like we have arteries for the oxygenated blood to carry in our body. We have veins to carry the blood without oxygen in our body. Similarly, we have another system which is called as a lymphatic system. Now what lymphatic system does, whatever the waste products or the byproducts from the tissues like our organs, which include our abdomen, these intestines, your heart, lungs, different parts of our body, this part will secrete some fluid which is called as a lymphatic fluid. This fluid will be going through these side channels which are lymphatic channels. They will reach to a station which is called as a lymph node, which act as a filters, and then these filters will filter all this fluid, and then a clear fluid is sent back to your circulation, that is in your into your blood circulation. So in a simple word, I will try to explain you what is lymphatic system. Suppose you can imagine a water coming from a river which will be taken through the pipes to a water filtering station. So this water will be processed, cleared, removed of all the germs or bacteria and metals in that, and then it will be pushed back to the households for the drinking or for household purposes. Same way the lymphatic system works. Whatever the waste products are produced from the organs, which it will go through these channels, it will reach to the lymph node. Lymph node will process this fluid, it will check for the germs, it will check for any cancer cells, it will just filter this all fluid, and it will send a clear fluid back to the circulation. That is what our lymphatic system does. So it's a part of our immunity. So what other organs, tissues which help in our immune system along with lymph nodes are adenoids, tonsils, spleen. They are also part of our lymphatic system. Next question comes in our mind is that how many lymph nodes do we have in our body? So it is approximately 600 lymph nodes are present in our entire body, throughout the body. And now the next question comes that where are these lymph nodes are located? So now lymph nodes are located in different parts. The common places which are in the neck region, in the armpits, both sides of armpits, in the chest, inside our thoracic cavity, in your abdomen, in the groin. These are the main places where the lymph nodes are stationed. So these particular areas, they will drain there, they will filter that particular organs in that part. Like for the neck area, they will drain the face, ears, nose, the hair, skin on the head and the neck, that will be drained here. For the axilla, it will be drained from the chest, your arms, from the back, from the both sides. Then the chest, inside organs like your heart, lungs, esophagus, that will be drained inside the lymph nodes of the thoracic cavity. Abdomen lymph nodes will be draining from the intestines, your kidney, liver, all those important organs will be draining into the abdominal lymph nodes. And the groin, they will be draining from your legs, your genital areas, from the back, from the buttocks area, all this will be draining in the groin lymph nodes. So these are the different stations where the lymph nodes are located, and they drain that particular part. Why it is important is when the lymph node of that particular area increases in size, or if it becomes painful, that means that particular area there is some deep problem inside that particular area, like the area which that lymph nodes are draining. That's what we are going to discuss when the patient presents with a lymph node or lymphadenopathy in the different parts. How the patient presents. When the lymphadenopathy occurs, so which age group will be affected? The age group affected is from the small children to adolescents, adults, and to the elderly. Anyone can get affected. What are the causes we can discuss? The causes, most common cause in the children's is common flu, which the children get, can cause lymphadenopathy. It's a temporary thing which subsides over the period of the time. So it's most benign condition. Benign means not any worrisome condition where the lymph nodes are enlarged. So that is one, viral infection. Second will be the bacterial infection, parasitic infection. Any bacterial infection affecting that particular part where the lymph nodes are draining can cause enlargement of lymph nodes. So that is infection. Then bacteria, even the chronic diseases. Chronic disease means the major diseases which it can cause are the tuberculosis, HIV infection can cause lymph nodes enlargement. So that's what all importance of the lymph nodes are. Then non-infective cases includes the cancers. Cancers can cause enlargement of the lymph nodes, and they help in diagnosis of the many cancers, the lymph nodes. Then some storage diseases like Gaucher's disease. So these are the causes where the lymph nodes will be enlarged. Now the question is how patient will be presenting. So the patient will present mostly with a swelling in that particular area. Particular area means suppose the patient is having any infection or any problem in the head and neck area, he will be presenting with a swelling with a lymph node. If it is a lymph node, I am telling, so he will be presenting with a swelling in the neck area. So it might be a single lymph node or it might be multiple lymph nodes. So when you meet a doctor, or when you have a swelling in the neck area, and you meet a doctor, go and consult a doctor, what questions are doctor will ask to come to a diagnosis that it is a lymph node and no other swelling. So the questions first doctor will ask you that since when you got the swelling. That's the first question. It's important whether the swelling is less than 1 month duration or it is more than 1 month duration. So this duration is very important. So like suppose we'll say two patients. One patient is coming with a swelling in the neck area with a swelling which is less than 1 month, and another patient who is coming with a swelling in the neck which is more than 1 month. So now doctor will ask the different questions for them. So the questions will be, the doctor will ask whether the swelling has occurred within 1 month, first question. Then the swelling, whether it is increasing in size or it is same. That question will be same for both, whether it is same size or it is increasing in size. Next question doctor will ask is whether it is painful or not. It's pain is important. If pain is not there, the patient will never go to doctor. That's what some patients do. They have no pain, so they do not visit the doctor. The pain is the gift given by God to us, so that patient comes to know that there is some problem inside, and the patient reaches the doctor or to take a medical help for the same. So the question doctor will ask is whether the swelling is painful or not. If it is painful, then doctor will think in a different direction. He will judge that patient is having a swelling less than 1 month, it is painful. Then he will ask whether the pain is continuous or it is like sometimes it comes, sometimes it goes. Then the next question you can expect whether the swelling is along with the fever or not. The fever is also important in this case. Then doctor will ask whether the fever is like continuous or it is coming and going. Why these things are important to know? That is swelling which is less than 1 month associated with the pain and fever. That means there is some infective etiology. Infection means either viral infection or bacterial infection or any parasitic infection might be the underlying cause. That's what doctor will start thinking about. So whatever history you give, it will help the doctor to come to a particular diagnosis. So now in the neck region, if the swelling is in the neck region, what next questions doctor will ask to point out which part is affected. So now doctor will ask whether you are having the toothache, whether you are having any pain while swallowing. Like sometimes you get tonsillitis. In tonsillitis, you will get a swelling in this area, like just below the chin area. There will be swelling. That are the lymph nodes actually. So the doctor will ask whether you are having cold, sneezing, any ear discharges there, you are having dandruff, you are having any pimples on the face, or your neck is hurting, any other swelling other than the swelling you have presented. So all this will help in diagnosing which part is affected. Suppose you say your toothache is there and along with that you are having swelling in the neck, that means you are having infection in the tooth. Doctor will try to treat accordingly. So when the swelling is like less than 1 month with pain, fever, doctor will treat with either your antibiotics if it is bacterial infection, if he is suspecting. If it is a viral infection, then doctor will decide whether if it is like mild viral flu and all, it will subside on itself, or he will give a symptomatic treatment. If he suspects any parasitic infection, he might do certain tests to confirm that. So this is the first patient. Now second patient, we have discussed that a swelling patient is having a swelling more than 1 month. Now he might say he is having pain, or he might have no pain with that. Swelling is increasing or not is important. If it is a lymph node which is increasing in size and the numbers of swellings are increasing, it might be associated with pain or without pain. Third question doctor might ask is whether any discharge, any water or fluid is coming out from that swelling, whether the skin over the swelling is changing, any color changes there, like it is red, or it is any color change you have noticed over that swelling. All those things are important to further decide whether to give medicines or to investigate the patient. Is swelling more than 1 month? If it is a lymph node more than 1 month, it should be further evaluated. It should not be just treated with medicines, because there might be some deep infection. So the lymph nodes are the indicators which helps in further diagnosis. They are indicating that something wrong with your body, and we should diagnose it in a correct time to help improve our health and to prevent the further problems, like to go to the next level of the problem. Suppose a swelling with more than one month, you are having fever, like evening rise, every evening you are having fever, you are losing the weight along with that. Doctor might think it might be a tuberculosis. Every time tuberculosis will not present with a cough. Tuberculosis can affect different parts of our body. So lymph nodes are also affected. Sometimes patient have no symptoms, but he might present only with a lymph node swelling in the neck or any other part. So accordingly, doctor will try to investigate further to rule out whether it is tuberculosis or it might be cancer also. A swelling more than 1 month in the neck and with no symptoms, patient might have no pain, but it is increasing in size, and it is becoming like size is increasing and more number of lymph nodes are involving. Doctor might have to think whether it is infection or whether it is a cancer, so he will proceed with further investigations accordingly. That's what importance is given to the lymph nodes. That's why whenever you present with swelling in any part of the body, you should visit a doctor and take in proper treatment and investigations accordingly. Now this is a part of the neck. Suppose you have a swelling in the armpits. If it's a female patient having a swelling in the armpit, it's important to examine her the breast area, so that to rule out any underlying malignancy or infection to confirm. If she is like breastfeeding, infection of the milk glands, that is called as a galactosile. When the milk gets collected inside the breast, it doesn't come out, it might get infected. That can cause lymphadenopathy. So doctor has to rule out accordingly. Elderly patient having swelling in the armpit, but she has not noticed any other swelling. She is losing weight also. She is having decreased appetite. Doctor has to examine her the breast to rule out any underlying cancer. So that's what importance is given to the lymph nodes. This armpit area, the swelling can come because of any infection on your hand also. Any hand infection, any trauma on that area, swelling can cause indirectly enlargement of your lymph nodes. Not just cancer, I'm telling. It can be any infection which can cause. So that's why every part, it's important to check that part. So doctor will examine, check and ask you questions related to that part. If it is in the chest cavity, you will be having symptoms of like breathing difficulty, because the lymph nodes which are enlarged can cause a pressure on the surrounding structures nearby. So that can cause breathing difficulty or difficulty in swallowing. You might have a cough along with that. So that questions will go accordingly. If you are having lymphadenopathy, like lymph node enlargement in your abdomen, doctor will ask whether you are having loose motions, any abdominal pain is there, weight loss is there again, whether your appetite is decreased. Accordingly, doctor will ask you the questions. The lymph nodes in the abdomen and the chest cavity cannot be seen outside. So only the symptoms, like when patient having any pain abdomen or any cough or any pressure symptoms, then only doctor will think about there might be a lymph node enlargement, because they are deeper inside. You cannot see the lymph nodes on the neck, armpits. You can feel it, you can see them. Sometimes when they are enlarged, you can see them. Even in the groin, lower part, you can feel it, and you can even see the lymph node enlargement. These are the areas which can be seen, but abdomen and chest cavity lymph nodes cannot be seen directly. For that, further investigations is required. So same way, if you have a swelling in the groin region and if there are lymph nodes, doctor has to differentiate whether it is lymph node or any other swelling. If it is lymph node, he will examine your entire leg. If there is any trauma, any injury, any cut, any infection, any boil on that area, he will check your genital parts, private parts, to see whether there is infection in that area. So all these things will help to come in a proper diagnosis. So these are the symptoms part. What next doctor will examine? Like when examining if it is in the neck region, if you are having a swelling in the neck region, doctor will ask you to the sit. He will check. First he will inspect that swelling, whether the swelling is which site it is located. There are different areas where the lymph nodes are located. There are chains of the lymph nodes located. So he will try to identify which area it is located, whether it is single or it is multiple lymph nodes. How is the color of the skin over that area, whether any discharging, any pus is coming out from that area. Then he will go on to inspect your mouth to see whether any infection inside, any tooth caries are there, how your tonsils are, whether gums are okay, any ulcer is inside mouth. He might check your ears to see whether any discharge, check your nose if any infection is inside. He will check your eyes, he will check your hair or scalp area to see if you are having any infection in that area, like dandruff if you are having. So doctor will do this examination for you if he suspects the swelling is a lymph node. If you are having swelling in the armpit, you can expect a doctor to check your entire arm, check your chest area, then touch that area to see if any specific swelling is there, it is painful or not. If it is a groin area, you are presented with a swelling in the groin area, then doctor will try to check that area. He will examine your legs, he will examine your private parts also to see if the infection is or any swelling is coming from that area, as the lymph nodes will be draining your private parts and then the lower limb also. So accordingly doctor will examine that particular area to come to a proper diagnosis. Now what investigations you can expect when you get a lymph node? First, we have to differentiate whether it is acute condition, that is if it is swelling which is lymph node which is less than 1 month, then doctor will try to treat you with antibiotics first. He will give you antibiotics of 5 days. We'll see whether you improve. If after examining and all, if you find you are having a tooth caries, you are having tonsillitis, or you are having ear discharge, he will try to treat that part, not just give you painkillers for lymph node to decrease in size, because it will not help unless and until you treat the root cause. Then only the lymph node size will decrease, because they are the just indicators, they are the filters. They will just filter out whatever is coming from the deeper organs. So doctor will treat you for tonsillitis or the tooth caries or the ear infection. If you have dandruff, doctor will give a shampoo for that, medical shampoo to treat that. And once that infection or that area is treated properly, your lymph nodes will start decreasing in size. Your pain also will decrease. After giving medicines, the swelling is not decreasing. The doctor will have to further think about other possibilities, like a swelling more than 1 month in the neck region or in the arms region or in the groin region. Doctor will ask you to first get a complete blood count test. He will check whether you are having underlying infections or not. He will ask you to get a chest. Next important investigation doctor might ask you is a fine needle aspiration cytology, that is called as a FNAC in short form, or a core biopsy. So depending upon which lymph nodes are involved, doctor will take a decision. Most common investigation done is a fine needle aspiration cytology. You will ask how it is done. So fine needle aspiration, wherever swelling is there, usually done by the pathologist or radiologist under ultrasound guidance. If the pathologist is doing, he will be having a needle. First he will give you local anesthesia in that area, most probably, and he will insert the needle and he will aspirate if any content in that area, like he will try to pull out some fluid from your lymph nodes, and then the pathologist will check under microscope to find out what is the problem, means what type of, whether it is infective or whether it is a malignancy. Malignancy means any cancer cells are seen or not. FNAC reports usually take 2 to 3 days depending upon the what problem you are having. It might take like 1 week depending upon which lab you are going. So once the report comes, then further treatment will be planned by the consulting doctor. If FNAC is suspected any serious problem, doctor might ask you to get a CT scan done of that area, or doctor might ask you to get an MRI. Accordingly, doctor will take a decision to further confirm the diagnosis. Like suppose if a patient is having family history of tuberculosis and he had a past history of tuberculosis, doctor will this investigations done to confirm first whether you are having tuberculosis or not. If it is tuberculosis, you will treat accordingly. Suppose the lymph nodes are showing cancer cells, now doctor need to know from where these cancer cells have came. So there is a further investigations which can be done, that is called as immunohistochemistry. That's a further test which is be done. Along with the doctor will ask you to get CT scan or MRI or even PET CT scan to find out which area the cancer is located. That's how lymph nodes help in diagnosing the different conditions. Doctor can perform is the biopsy, like excision biopsy. Sometimes your complete blood test will be normal. You might be swelling is there, but then your blood tests are normal. Your FNEC, that fine needle aspiration cytology, may give an inconclusive report. Right? Doctor may not get adequate sample to check it, give a diagnosis. Then in that situation, you might have to do a complete removal of that particular lymph node. Like suppose you're having a swelling in the neck region, which is persistent more than 1 month. After doing investigation, there is no confirmed diagnosis you got, and doctor suspects there is some underlying pathology. Then doctor will advise you to get that lymph node out, that particular lymph node, the enlarged one, and then the complete lymph node will be taken for the histopathology examination. The pathologist will make multiple cuts on that lymph node and check the different part of that lymph node to come to a proper diagnosis. So it can come to a might be an infective condition also. It can be a malignant condition also. So accordingly, the biopsies are taken for the entire lymph node is taken. So what you can expect when doctor will advise you for a biopsy is biopsy is done by a surgeon, and it will be either under local anesthesia or it can be under a general anesthesia. If the swelling is very small, very visible, and if the patient is comfortable to undergo local anesthesia, but this procedure will be done in the operation theatre. The doctor will ask you to come in the morning, prepare you for the procedure, explain you in detail what he's going to do. He will give a local anesthesia in that area. He will remove the lymph node and he will send it for the histopathology examination. After he might put a absorbable stitches on that area or removable stitches, which stitches will be taken out after 7 to 8 days. The care you have to take is just you have to clean that area. Doctor might ask you to come visit him after 4 or 5 days to check how the wound is, and then he will ask you to come for follow-up when the report comes. That will be the under local. If it is under general anesthesia, then doctor will ask you to get admit. It will be a day care procedure. Like morning you come, you have to come nil by mouth without eating anything. That doctor will explain you, like for 7 to 8 hours you have to come without having any food. Water, mostly 4 to 5 hours is acceptable. So after that, doctor will show to the anesthesia. Anesthesia will explain you the procedure, how the procedure will be done. Mostly general anesthesia will be given. Doctor will take you to the theatre. In operation theatre, same procedure will be performed. General anesthesia, you will not have any pain. Once the surgery is done, you will come out of the anesthesia, and same day, like after 4 hours or 5 hours, once you start eating, once you have food, water, doctor will discharge you same day. And then he will call you back for the dressing, and finally when the report comes, to discuss the report with you. So another thing I would like to tell, these are the lymph nodes which are easily accessible from the outside, like the neck or axilla or the groin regions here. These are accessible. The lymph nodes which are in the chest cavity, they are not that easy to take out. So there are the different techniques to take an sample for the sampling of those lymph nodes. That needs a proper anesthesia to do these procedures. Even abdominal lymph nodes, if indicated, has to be done under general anesthesia to find out the underlying pathology. When all the investigations are not giving you the proper diagnosis, doctor will ask you to go for biopsy of the lymph node, because lymph node, as I told you in the beginning, they are the filters. They will drain that particular area and the organs, and they will try to trap the infection. They will try to trap if the cancer cells are there, they will trap it, and they will help you in confirming the diagnosis. So the takeaway message which I will give you about the lymph, if the swelling on your body is a lymph node, any swelling on your body, if it comes, you should not ignore it. You should get it evaluated from a specialist in that field, because these swellings can be anything from the fat. It can be the lymph nodes, just the blood collected below the skin, or or infection, that is abscess, it can be anything. So it has to be ruled out what is the underlying problem. If you find the problem in the beginning itself, it helps to prevent the further problems. Like you get, when the thing is smaller in size, it's easy to treat that. Once the thing becomes bigger, it comes with more problems, more complications, it takes more time, more hospitalization, it will be more costly also to the patient. So the lymph nodes are very important. They are important part of our immune system, and when the doctor diagnoses it's a lymphadenopathy, he will treat you accordingly, whether it is infective condition or if it is any serious problem like cancer. Thank you very much for listening to me and watching my video. If you have any doubts, please write in the comment box and I will try to clarify more further.